with the Bagandara or call it medicinal plants, especially Apamarga we are using, which is a standardized form. So ashes of medicinal plants are called Shara, and it comes under Anushastra and Upayantra also. The main feature or the action is by its Chetana, Bedhana and Lekana property, and it is even useful in Tridosha Vikaras, so because of the medicinal property of the plants which are mentioned. And it is even safely we can use it in patients who are afraid of surgery. Then coming to the Nirukti, Tatra Sharanat Shananatva Sharaha. So what which destroys or which kills any dead tissue or like that, or like piles, ashes, like that, whatever is not needed or any track. So that is destroying that part. So it is called a Shara. Shara Mahatva. Shastra Anushastrebhya Sharaha Pradhanatamaha Chedya Vedya Lekya Karanat Tridoshiknatvat Vishesha Kriyavacharanadja. So among Shastra and Anushastra, even among Shastra also, we are considering it as a best one. Pradhana Tamam. Okay. Then because of the actions, three main reasons, that is Chedana, Chedya, Vedya, Lekhi Karana. It is having these all properties or actions. Then Tridoshikna. It can be used in all the three doshas, and Vishesha Kriyavajarna. Like it can be used even in Pitta conditions where we can't do Agni Karma and all. In that condition, even we are using Shara. So that is the importance of Shara. Then Shara Guna, I already told. Tridoshikna. It is, I have highlighted some points, you just go through that. Nana Oshada Samavaitva, because of the different medicinal drugs which are involved or we are using for the preparation of Shara, it is Tridoshikna. And it is having white color. Okay, what we are preparing that basma or Shara will be in white color. Though it is, so it is having some Saumya property. Though it is Saumya also, it will be doing Dahana, Pachana, Dharanadi, Shaktir, Aviruddha. Though it is white in color, it will be having all these Tikshna properties also. Agneya Aushadha Guna Bhuishtatvat, Katuka, Ushna, Tishna, Pajano, Vilenaha, Shodhano, Ropanaha, Shoshanaha, Stampano, Lekana. So all these are the properties through which it is acting on a or particular disease. Especially in Krimi, Ama, Kapha, Kushta, Visha, Medam, Upahandyaha. In these all diseases, it is used, and in case of excess use, it is even resulting in pumsatva, like impotency. It is causing. So that is about the properties. Then coming to the classification. Mainly, this is actually based on you have learned in Rasa Shastra by Shidja and all. So that in that extra what we are learning is that according to the basis of administration. That is the Vividaha Pratisaraniya Paniya. Okay. So Pratisaraniya, what do you mean by that? So it is external application. We are using as external application over any mass. So that is Pradisarniyam. Then Paniyam, it is internal administration. So that is the main classification, Pradisarniyakshara and Paniyakshara. Then based on the concentration or the potency. So Trividam, what Mridu, Madhya, Tikshna. So this is based on how we are making it potent, like adding some extra drugs. So that we will be coming in coming slides, you will be knowing. Then according to the preparation, so how the what is the potency according to the preparation, how it came out, uttama, madhyama, adama, like that. Then herbal, mineral and all that already you have in second year you could have learned. So our importance is these two, Pratisarniya, Paniyam and Mrudu, Madhyama and Tikshna. So how to prepare, next how, which are the condition we will be using as Pradisarniyakshara. Tatra Pradisarniyaha Kushta, Kitiba, Dadru, Mandala, Kilasa, Bagandhara, Arbuda, Arshu, Dushtavrana, Nadi, Charma, Kila, Tilakalaka, Nyacha, Vyanga, Mashaka, Bahya Vidradi, Krimi Vishadishu, Ubadishyade, Saptasuja Mukha Rogeshu, Upajihviga, Adijihviga, Upakusha Danda Vaidarveshu Tisrushu cha Rohinishu Eteshu. So all these are the diseases where there is indication of Pradisarniya Kshara. That is externally how we are using. Mainly, most of the conditions are skin diseases. So mainly you will be knowing all these in Kaishikilza, Kushtakidib and all. Mainly the Shudra Rogas or coming under skin disease. Then Shalya important diseases like Bagandhara, Arbuda, Arsha, Dushtavrana, Nadi Vrana, then Charmakila. All these comes under Shalya important diseases. Then some in Shalakya diseases, Rohini, Mukaroga, Upajihua, Dipjihua. So just divide like that and make it some code and learn it because it is important asked question. So these are the indications. Then coming to the Pani Kshara. Pani is to Gara Gulma Udara Agni Sanga Ajirna Arojaka Anaha Sharkara Ashmarya Abhyandara Vidradi. So in that we have seen Bahya Vidradi. Here it is Abhyandara Vidradi. Then Krimi Visha. This is common for I had already in this mentioned. Common in both that Vidradi, Krimi Visha. And Vidradi means on Abhyandara Vidradi in Panya and Bahya Vidradi in Pradisarni Akshara. So here you can see, so internally, mainly like Garavisha, then Gulma, Udara, Agni Sanga, Ajirna. In all these, that we are using some internal, as an internal medicines, we are using the Shara and some other which need strong action like Ashmari, Sharkara, then other Arshis and all. So next coming to the contraindications. Ahidastu, Rekta Pitta, Jwarida, Pitta Pragirdi, Bala Vriddha, Durbala, Brahma, Mada, Murcha, Timira. All these are the contraindications. As you know, it is like increased pitta is there in which is also a condition, and Bala Vriddha, Durbala and all. Mostly we will be contraindicating in all the procedures. So and those are having Brahma, Mada, Mursha, Timara, and all the other contraindications. And even again, after some sloka, it has explained like Durbala, Bala, Stavira, Biru, um, Sarvanga Shunam, like edema in the full body, then Rekta Pitta, Garbini, Ritumadi, Pravruddha Jwara, Pramehi, Ruksha Shadakshina, Trishna, Murcha, Ubadruda, Kleba, Apavritta, Utvritta, Falayoni, like prolapse of uterus. In that conditions and all, the contraindications are again explained. And especially in case of Marmasira, Snayu, Sandhesti, Tarunasti, Sevini, Damani, Galanabi, Naganda, Shefa, Srodo, Aswalpa, Mamseshu, Desheshu. So if we are using in these conditions, sometimes the result may not be that. So only there's a even in Shara Sadhi Vyadi, we should be contraindicating in such conditions. Then coming to Shara Nirmana. So actually, how this is the where we are coming across with the based on how we are preparing it, how it is made into Mridu, Tikshna, and Madhyama quality. So they how we are preparing. So first of all, they have told the person, this is of the preparing the shara. Shara should become like in any procedure we'll be telling that in auspicious day or in well shuchi, then fasted like that. We have to go and collect the particular tree, and that time is given that during Sharat Ritu. So here Kala Mushkaga. So first one example is given one tree that is Kala Mushkaga tree, which is grown in an auspicious place, which is middle age and big in size. After offering any worships and all, we have to get it ready. The next day, we have to cut it into small pieces and made into a heap. Okay. So after that, we have to burn it. Okay. Adding some Sudha Sharkara, that is limestone. And we have to set it fire and using a tila plant, dried tila plant should be used to heat it. Then after the next day, actually mostly after it will fully burnt, we have to collect that ashes and limestone separately, and then we have to prepare. Okay, so in that we will be taking the basma and adding one drona of ash and six part of water or cow's urine. According to the Tikshnada, we will be adding that. Usually we will be doing it water only. Then we have to stir it, and usually what we will do is we will keep for one night. Overnight we will keep. Then next day we will just filter it through cloth 21 times. Okay, so we have to filter it, and 21 times we have to filter and get the uh, like cow's urine color it should be. That water should be taken and we have to boil it. So all the water soluble principles are absorbed in that fully, and that only, without any dust, without any particle visible, we have to get that, and we have to start cook, like boil it for continuously, constantly stirring, and till it is becoming slimy. Okay, so after that, we have to filter it with a thick cloth and into another vessel, and again we have to cook. In that, we have to remove some part, like 1.5 kudava is taken out. That actually it is called shara jala. Okay, that actually one part we will be taking, and it is used for mixing some kalka, to make some kalka. So, and even it is kept for long, after long time, the shara property will be lost. At that time we will be using this shara jala little bit we have kept aside, so that we can add it and make it a paste, so that the tikshnata will again be increased. So in that 1.5 kudava is taken to prepare the paste. And what all things are to be taken for the paste? That is 8 pala of ash of shankanabi, that is etc. That is kata sharkara, basma sharkara, sudha ashma, shira paga, and shanka. So mostly we will be using sudha only, limestone only, and shanka we will be using. And it is, I'm audible?
Yes, ma'am.
Okay. Yeah, yeah. Okay. Then made red hot. So I will be showing the pictures in later slide. So it is made into red hot in another vessel, and then macerated into the this water, whatever we have to we have taken that made, it is made in as kalka and added to this boiling shara or shara jala we will be using as a pradivapa. Means in between we are adding that as a kalka. So it is called pradivapa, and then cooking is continued. Okay. Then still it is becoming a like a lehya paga we can call, like a neither solid not very liquid. So like that we have to stir and then taken out and keep it for drying. In that we will get a powder like thing. So that is the shara. Okay, then we have to keep it in an iron vessel with a lid and preserved carefully. So this is the stage where we called as Madhyamakshara. So in between, we are not adding that Shankanabi, etc. That is Mridu. Okay. So in between, I have told like these are the other Kalamushka is already told in that. Uh, what we are taking that tree, that is kalamushka. Then here we will be using some other also kudaja, palasha, ashakarna, paribhadra. So like this all these drugs, 23 drugs are given. Have just for your understanding, I have added the botanical name and family. Just go through that. I will be sharing the ppt to them. Then, so next, so I told that what we have prepared now is Madhyamakshara. Now, what is Mridukshara? If we are not adding that kalka, okay, only we are stirring it and making it to that paga only, that like what do you call, paste like form only, and getting it dried into powder without adding kalka. It is called Mridu. So that Mridu paga is used for paniya. Okay, so this sharam itself, if prepared without pradivapa, is called mrituk shara, or other name is that samyuhimak shara. So that is mriduk shara. Then again, we have to increase the potency and make it tikshna. So in that, we have to add again potent or tikshna dravyas like danti, dravanti, chitraga and all. So these drugs will increase the potency so that it is having that much burning capacity. So externally, mostly in shara, Shara Karma or Shara Sutra, external application we will be using Tikshna. or according to the strength of the patient or according to the condition, we will be using the Tikshna or Madhya or Mridu. So when it is prepared with Prativa, but last we have added, that is with the Tikshna drug, it is called Pakyakshara or Tikshna. Okay. So even after sometimes the Shara will be weakened or the mild potency become mild. Then it should be soaked for some time for in a solution of Shara Jala. Okay. That Shara Jala which is we have taken out in between, we will keep a little bit for after future use also. So that we will add and use it so that to make the potency increase. So that is how the method of preparation of Pradisarnya Kshara or Tikshna Shara will be drying. So in case of practically, we'll be using Abamarga because it is one of the standardized one. So first we will be drying the plant, then burn, then 500 gram of Abamarga. That depends according to the quantity. Just I have got some example. In that 6 times water is taken, then filtered 21 times through cloth to get clean and clear solution that is like a gomutra varna, like a slightly reddish it will come. Then that filtrate 21 times we have taken, and that filtrate solution is boiled and evaporated and heated up to 2 by 3rd remaining. Then that red hot limestone and all are added, and again continued the mild heating. Then the liquid evaporates to the 1/3. At that time, Chitraka Kalka. Usually, what we'll be adding among that is mostly available thing is Chitraka. So we'll be adding Chitraka, and then lastly, we will get the fine powdered thing. So that is the Pradisarnya Tikshna. I think you understood, right? Then Share Guna and Dosha. This you have to by heart. Naiva adi Tishno Namridu Shuklaha Slekshno Ada Pichila Avishandi Shivaha Shigra Sharo Hyashta Guna. So 8 gunas are given. Naiva adi Tishno, not very strong. It should like if it is burning that much means it will be causing adi dagdam. So Naiva adi Tishna. Namridu. It should be having some potency. So Namridu. And color should be Shukla. Then slashno little bit when we are having that like paste like no, so it is like a slakshnada other pichila. So this and all should not be above excess. Okay, slakshnada means mild slash. Then other pichilada also sliminess also should not be much. Avishendi not spreading. Then shivaha means good. Then shigram, that action quickly burning the tissue what we are intending to do. Then these are the ashta gunas. Then adi mardava shraitya. So the adi is a common for all. Adi mardava, adi shraitya, adyaushnya, adi taishnya, paichilya, sarpida. So all these in opposite. So very mild, very white, very hot, highly penetrating, very slimy, or greatly spreading, or very thick, santrita, apakvada, not cooked well. Then hina dravida, the quantity of the drugs are or quality of the drugs are less. So all these are the shara doshas. Okay. Next coming to, so these all are the methods of preparation. How we have prepared the shara. Next coming to shara karma. Okay, so what do you mean by Shara Karma? Mainly, we'll be even questions are coming like Shara Karma Prayoga in Arshas. So, mainly that Shara Karma means externally how we are using in some diseases. So, mainly, we'll be using in Arshas. So, and all the indications given in the Pradisarnya Kshara, we can do that. So coming to when we are explaining, mostly we will explain based on main disease. So Arshas, here mainly we will be explaining about Arshas, how the procedure is done. So I think some briefly I will tell what is Arshas because Arshas you didn't come through that. Arshas means it is a growth. Okay, in the anal canal, some growth is there. The patient will be complaining of mass per rectum, and that is having like internal external classification is that, and we will be going to that deeply, and it is one of the important topic. So in that the levels are there, like degrees are there, first degree, second degree, third degree, and all. In that till when it is inside, it is not coming out of the anal canal. At that condition, we will be using Shara karma or if it is prolapsed or coming outside fully, then we will be using even Shara Karma also you can use, but sometimes we will be using Shara Sutra also, but still it is having some complications. So that is like instead of hemorrhoidectomy, like modern it is called hemorrhoids. I think you will be familiar with all these terms. So arshas, in that arshas we will be using Shara. So how it is done? Tatra Shara Sadhya Vyadi Vyadidam. So we have to ask the patient to should be made to sit or any whichever the position we have to, like in anorectal means we have to make in a lithotomy position, and then we have to see whatever the what are the how we niriksha, how we have to do, or what is the and problem pathology there we have to do. Then all the equipments necessary also should be there, that is agrobaharni yoktam, already fifth chapter we have explained agrobaharni and the collection of materials. So all the that things are kept ready, and we have to uh, tado asya tam avakasham. So mainly anorectal or anal canal, we have to niriksha, observe. Observation means we will be using proctoscope. It is the instrument to see the anal canal. Niriksha, avagrishya, avalikya. So it is told to little bit scratch so that there is mild bleeding, or it is the shara is getting absorbed properly. So niriksha, avagrishya, avalikya, lekhanam. Lekhanam means scraping. Then prachitva, prachanam, like small scratching should be made. Then shalagya sharam pradisarayet. Using a shalaga, we have to use apply the shara on that growth, or only on that growth. Normal tissue we should not do. We have to uh, apply only on that shara, and we have to keep only for vakshada matram ubeksheda. Only vakshada matram means 1 to 2 minutes maximum. We have to keep that. Okay. So that site is observed, then scrubbed and scraped or cut according to the condition. Then using shalaga, like vakshada matra means how much time we are using to pronounce 100 letters. Okay, so that is how we have to do. Then what happens? We can actually it is told pakku jambu phalam, like that it will color will turn. Okay, that is the lakshana, and at that time we have to apply tatra amla varga shamanaha sarpir madhuka samyukta. So we have to apply. Usually, what we apply is lemon juice. Okay, lemon juice. We will be applying using a cotton. I will be sharing the videos, okay, because I'm using in phone. It is difficult to show, attach the video. So I will be in the notes. I will be sharing the link. You can see in our YouTube also. So many great surgeons have explained the Shara Sutra videos nicely. Praveen Patil sirs and all, very nice explanation is there. That link I will be sharing. So tatra amla varga. After that we have to apply lime juice. Then or after that we will be applying sarpir madhu samyukta. Okay, that is the paschat karma. And if it is deep rooted and does not fall off, some extra like amla kanchika bija and tila madhuga are made into paste, and it is together with the madhuga or added with the ghee, we will be applying in that region. So that is about how the procedure is done. Then Dagda Lakshana. So if the we have to have done the procedure is Samyak, means Samyak Dagda Lakshana will be there. Vikarobashama. So don't expect that in suddenly it will be gone. Only it will take like 3 to 7 days in Arshas and all. It will take 3 to 7 days. Vikarobashamo. So that mass will be fallen off, necrosed and fallen off. Then Lagavam, the patient will be having lightness of the body, and Anasravam, any oozing or bleeding was there, it will be gone. Then Hina Dagdam. If Hina Dagdam means what happens? There will be Tohuda Kandu Jadyam. Okay, there will be pain, itching, and all. Then Vyadi Vriddhi. So the if we have didn't if we didn't do the properly, there will be increase or aggravation of the symptoms. In Adidegdam, Adidegdam, what happens? There will be severe burning sensation, suppression, Taha, Paga, Raga, Strava, Angamarda, Klama, and the patient will be very much tired, and even it can reach to general symptoms like Klama, Vipasa, Morsha, even death also. So I have made in table form. You can just learn, go through that. Samyak Dagda, Hina Dagda, and Adi Dagda. In the first, Samyak Dagda Lakshanam, alleviation of the symptoms and the signs of disease without any secretion. Then well-being and lightness of the body will be there. Hina Yoga means there will be pricking pain or itching will be there. Then numbness, loss of movement means that body part. Then aggravation of the disease will be there. Hina Dagda or improper Dagda. Then Ati Dagda means there will be burning sensation, separation, redness, secretion, body ache, thirst, faint, or even death. So what you have to do in case of Hina Dagda? We have to again apply Shara, and then after that we have to apply Dhanyamla, Tila, LSG, Lepa. Then Adi Dagda, we have to stop the Shara application, wash with the Kanchika, Madhu, Grita, Ishtimadu oil, Tilakalka, and cooling measures should be given. So that are the Samyak Lakshana, Hina, and Adi Yoga Lakshanas. So why we are applying Amla Rasam? Okay, that is one question. Why? Because it is having Sharam. How it is? It will neutralize with the Amla Rasam. So that is a sloga here. That is mode of action of Amla Rasam, which is we are doing as a Paschat Karma. So this Shara is having all the six rasas except Amla. So if you are adding Amla to that, that because of the Amla predominance, it will be turning to sweet or Madhura rasa. Okay. Amla Varjan Razan Share. Shara is a Amla Varja Sarva rasa. Means Panjarasa. Then Kaduga rasa is the Lavana is the Anurasam. So if when we are adding Amla to that, then it will be turning to Madhuryam Shamam Apnodi, because of the Madhurata which is getting converted because of the addition of Amla Varga, it will reduce the complications. Okay, so only in Paschat Karma we will be using Amla Rasa. Sometimes it is asked in Viva and also just go through that. A point is needed, no need of learning sloga and all. So this is all about Pratisarnik Shara. Panik Shara actually it is explained in each of the disease, how which all the Yavak Shara or Palash Shara, like that. So many diseases they have given internal, so that you just never it is asked like that. So just know while learning the diseases, you just note and go. Mainly explained in Gulma Chigilsa in Sushruta Samhita Uttara Tantra. Okay, in that Gulma Chigilsa, Panik Shara is explained in that Shara Varti, Shara Piju, and all are told that you can just go through that, or we will be teaching you while we will be coming across that in the diseases. Now, one of the important question, that is application of Shara in ashes. I have already told in hemorrhoids or ashes, we will be having some mass per rectum. So it is a abnormal growth. Okay, mass per rectum or abnormal growth or piles, hemorrhoids, what we call that. And that is actually the varicosity of the hemorrhoidal veins. Superior hemorrhoidal veins are becoming enlarged or engorged, and it is giving rise to bleeding per rectum also. Okay, so in that case where there is like mass is there, in that case we will be applying shara. So what preoperatively or purva karma we need, we have to agrobharani of the things we have to collect. Required instruments are otoscope, then prepared shara, then lemon juice, then the forceps or any artery forceps, etc. Whatever things are essential to catch hold the skin and surrounding skin and the pile mass. Okay, so night prior to the patient, the procedure, the patient is advised to have a like sorry, to have diet afterwards nil orally. Okay, night we have then the preparation of like light food we have to give, and nil, and after night we have to make a nil oral. Then part prepared, and means any hairs are there and all, we have to ask them to remove or make the nurses do the preparation of the part. Then soup water enema, so that when the any is the residual any stool is there, it will be obstructing our view. So we have to give a enema 2 to 4 hours prior to the procedure. Then operatively, mostly we will be doing under lithotomy. If the patient is not cooperating, or it is mass is big only, we'll be going for spinal anesthesia. So in lithotomic position under local anesthesia, also spinal anesthesia, the part cleaned with the aseptic solution. That is first with the betadine, first with spirit and then with betadine solution. We'll be cleaning that area and covering and draping and all that. Then we have to insert the arshoyendra or the protoscope smeared with ghee, or in Ayurveda terms we are telling means we should be smeared with the ghee. But modern people they will be using lignocaine gel. So here we have to use a ghee. Mostly we'll be using Jatyadigrita and all, so that it will help further healing also. Then we will be using protoscope or Arshoyendra, and it is introduced into the anus, and the pile mass is observed, that Nirisha term, okay, assessed. Okay, then we have to make a little scraping or rubbing on the pile mass. After that, the Shara is applied into the internal pines and piles and wait for a Vakshada Matram. Okay, 100, how much time we are pronouncing 100 walk. Okay, so that is around one, maximum it will go to 1 minute only, but usually 45 seconds like that only we'll keep. Then pile mass, we can see the color change. Okay, once we are removing the before removing the protoscope, we can see actually pakwa jambu phala, okay, reddish black because of the little bit necrosing or a little burning of the that region or the pile mass. We can get pakwa jambu phala sadrishyam, we can get the pile mass, and then we have to wash with the lemon juice and apply Yashti Madhugrida, and Ashoyendra or protoscope is removed, and we'll be packing with the Mahanarayana Taila or Anu Taila. Then coming to the post-operative, or like internally we have to give liquid light only, diet only, the 4 to 6 hours. After that, packing of the after 6 hours, packing of the anal canal is removed, and six bath is given, and Triflagugulu Gandhagarasayanam. All this help in healing. Then Shakara Churna, that is mainly for to relieve constipation because of the procedures and all, or any GI complaints, we will be giving that. Then Anutaila or Mahanarayana Taila per rectally twice a day is given. So this is one of the example in which before application how it was fully bleeding, is that mass is very big, in that we'll applying using actually here spoon is used, and there is some shalaga made separately for, and split protoscope also used sometimes, and we can see in the video. Okay, then this is how it has turned or necrosed. Okay, after application of Shara, that Jambu Falavarna is given. So, what are the advantages here? Operative, mild or post-operative. If we are doing hemorrhoidectomy, means that area full is getting wound. Okay, ulcer is forming. So, or wound is forming, like incisions we are putting, we are tying it. So, mild post-operative pain only is there in case of Sharakarma we are doing. No bleeding. Then minimal hospitalization, no scope of recurrence. That is an important part. Recurrence, even in Shara Sutra and Shara Karma, recurrence is very low, like because if the patient is continuing the Nidanas only, it will come. Otherwise, in that same position, never it comes. So, no scope of recurrence, no strictures formation. That the anal stricture or any incontinence, nothing complication will be there. Then Shara Karma, like in one sitting, we can treat the whole pile mass. So the total duration of the treatment is reduced. Then coming to the complication, but in some cases, because of the Tikshna, if it is very much and all, some cases we will find as bleeding. Bleeding is there, sometimes severe pain, because Shara means itself is Tikshna. So there will be some, and that part is very vascular. So bleeding chances are there, pain is there. Then discharge also, some mucus secretions will be coming. Then sometimes rare only stricture and recurrence are may come. Okay, Then coming to the mode of action, so how it have it has the action is like it
नहीं नहीं
coagulates
मैंने
the
तो नहीं किया था
proteins in
ये
the hemorrhoidal
इसका
plexus.
ऑटो
So
वाली का होता है
disintegration of
बेसिकली।
hemoglobin happens, and because of that is blackish
अरे
brown
मुझे अपना
discharge
चप्पल
will
दिखाई दिया
come.
तो मेरे को लगा कि मैंने
Then
पहन लिया।
it will cauterize the pile mass. Then there will be size in the decreased size of the pile mass, necrosis of the tissue, and that necrosed tissue mostly after 3 to 7 days the patient himself will come and tell that some mass has gone, like while passing motion some black thing has gone. Okay, so that is necrosed tissue and sloughed out. That sloughing of the mass will happen within 3 to 7 days. So we usually give the 7 days follow up time. Okay, then after that the scar formation, fibrosis. I'm audible.
हाँ डॉक्टर।
Okay, wa? Sorry, one call came. Sorry for that. So next is so what happens is there is obliteration of the hemorrhoidal veins and complete wound healing if within 21 days. So that is that and need not no hospitalization. That is the best part of that. So that is a mode of action. Next, coming to Shara Sutra. So what do you mean by Shara Sutra? First of all, I'm showing the pictures of the persons who have done the great thing of standardization of Shara Sutra, because actually the reference of the in Sushruta Samhita, we are only brief term as Shara Sutra. The term only is explained, and how to do the Shara Sutra is explained, but no how to prepare Shara Sutra is not explained. It is explained in Chakradatta. Okay, so based on that, they have created standardization of Shara Sutra using Apamarga Shara. So these are the great persons like Dr. P.S. Shankaran, Dr. P.J. Deshpande, and Dr. K.R. Sharma. So how we can prepare Shara Sutra? Bhavidam Rajani Churnehi Snuhi Kshire Punaha Punaha Bandhanat Sudradam Sutram Chintanat, sorry, Chinatya Arsho Bagandharam or Binatya Arsho Bagandharam, both are this are is there. So it is the reference is in Chakradatta Arsho Adhikaram. And even in Bhava Prakash by Shiji Ratnavali, the references are compiled. Then in Rasa Kamadenu, same reference in different way. Arkas Nuhi Payor Lipte Punaha Sutram Vishoshayet Dvivaran Shoshayet, sorry, I think Trivaran Shoshayetu Shareneva Pralepe. So that is the indication where we have that reference of telling how to prepare Shara Sutra. So mainly in Shushru Samhita, it is explained under Nadi Vrana. In the chapter Nadi Vrana, Chikilsa, in the part of Nadi Vrana Chikilsa, it is explained. And the terms like it can be used in Arbudadi is explained. So in very brief only, we'll get in about the Shara Sutra. So how we can prepare? For that, we need Apamarga, then Snuhik Shira, then turmeric, and the machine or the cabinet. Shara Sutra cabinet is needed for the drying. Okay. So collection, but first we have to collect Snuhik Shira. That is, we have to cut from as linear cut. We have to get in a glass bottle and care to be taken so that otherwise it is also very tikshna. Then we have to use it before it closes. Then preparation of Apamarga Shara already explained under the Pratisarni Shara only. So we will be taking samula, that is panchanga, we will be taking and burning in a large quantity, and 6 times water is added and filtered 21 times, then boiled in mandagni till we get the dry powder of the basma or the shara, then stored in airtight iron vessels. Actually, it is told iron vessels. Then 21 coatings we should do. Okay, so first 11 days we have to apply Snohik Shira alone. So this is the thing they have standardized. Okay, this Deshpande and team have standardized like a 21 coatings should be there. In that first coating should be of Snohik Shira for 11 days. And daily we have to keep it in the Sharasutra cabinet for drying. Okay, first 11 days, first Nuhi Ksheralon, then next 7 days Nuhi Apamarga Kshara, and then last 3 days Nuhi added with a Haridra. So that are the 21 coating. Then indication. So where we should use Shara Sutra. Krisha Durbala. So this is a reference from Shustra Chikilsa 17th chapter, that is Nadi Vrana Chikilsa. In that Krisha Durbala Biruna Nadi Marmasridachaya Shara Sutrena Tam Chindyat Natu Shastrena Buddhiman. So any surgeon who is having any procedure to be done in case of Krisha Durbala Biru, and in case of nadi, like any sinus formation or a tract formation is there, tubular any vrana is there, and marma shrida also. Like in Guda, it is Guda itself is a marma. Okay, in that case we should not do shastra. Okay, shastra we should avoid. Instead of that, we have to do Shara Sutra. You know, in modern, if we are doing all the surgeries and all, mostly the anal incontinence is the result. So that itself tells the importance of Shara Sutra, what we can do, the action of Shara Sutra there. So that is it is explained even Bagandhara, Arbuda and all. Then contraindications are there, like any serious like sinuses from osteomyelitis. It is very uh, like drastic condition. In that case, it won't be giving result. Then tubercular and fistula in ano, fistula from ulcerative colitis, Crohn's disease. So these and all, it is contraindicated because it is not giving much result. Hidradenitis suppurativa, that also mostly modern like skin flapping, because it recurrence are more in these cases. Okay, then if already there is a urethral and urinary fistula also, it is action is not good. So we are contraindicated, but no textual reference is not there. Only in the case of practical, this contraindication is told. Then coming to one example, how to do the procedure, Shara Sutra application. Preparation of the patient, we have to like counsel the, because it is a dreadful disease. So we like fistula in nano. So what is fistula in nano? What it is a track actually. We'll be dealing with it later. So there is one external opening and internal opening is there, and there is communicating track between that. Okay, so near perianal region anywhere it can occur. That rules and all is there, like good cells rule and all is there. You can just go through that if you are interested now itself. Then that track we have to cut it using Shara Sutra. Okay, so that is a indication where sir, okay, we have to prepare the patient. Then okay, first we will be giving TT. Okay, injection TT will be given. Then cytokine test dose also will be given. Then these all are the investigations, because we are there will be bleeding and the blood, all the instruments will be contaminated. So we have to take care, like HB, TCDZ, according to for the patient's wellness. We have to do all the parameters for the surgical procedure, so that there is no complications for them. So HBTC, DC, ESR, and BTCT also, because bleeding will be there in case we are not checking, and some blood related diseases are there, bleeding disorders are there, there may be complications. So we have to rule out everything, and under surgically fit condition only we have to do. Then we for our safety actually HIV, because we are using all the instruments and exposing our instruments and ourselves to the blood of the other person. So we obviously we have to check for HIV, HBsAg. Then to rule out like tuberculosis and all, we have to check for chest X-ray, ECG, for getting the heart and lung any complications also, that we have to see that and all. Then finally for the investigation, especially for the fistula, that is fistulogram. So to the find the track, anywhere there is any diversion to the track, or may result in complication, or like anal continence, incontinence can occur. Like that we have to go for an investigation, fistulogram. After getting the fitness of that, and we have to apply Shara Sutra. So Eshinya Gadi Manvishya Shara Sutranusarinим Sujim Nidadyat. Okay. So Eshini, you have heard what is prob. Okay. In Yandra Shastra, we have heard that we are having one prop, like olive tip will call. And in one type, actually, it is a sharp, like a needle also. And the back side, there will be a minute hole. In that, we can tie the Shara Sutra. Okay. So, Ashenya, using a prop, Gadi Manusha, we have to see the track. Gadi means the track, how the, or the sign is. We have to get the manusya. We have to find the track to which it is coming. In case of pilonidal sinus, is one of the anorectal disease. In that case, we won't be having any external opening. So we have to see how much inside it is going. So that is because it is explained in Nadi Vrana. There is no opening. Gadi Manvishya Sutran Sarinim Suji. So first we have to see the track, then we have to use the suji or probe which is having that tip as suji, and backside is attached to Shara Sutra. Nidadyat Gatyande. So at the tip of the sinus opening, second opening, we have to take it out. Tado unnamya ashu nirharet. Because there is only one opening, we have to take it out through an external opening which is made by our own, and it should be taken out. In case of Bagandhara or fistula, we have to take it inside the anus. Inside anus, we will be taking it and tying it as a. You just see the video, then it will be easy for you. I will be sharing that link. Sutrasyadam. Then we have to tie both the side of the both the thread ends. Okay, Sutrasyadam Samaniya, and we have to tie the knot with a Gadam Bandam. It should be tied tightly. Tadaha Sharabalam Viksha Sutramanyat Praveshet. That is about rethreading. Mostly we will be rethreading like 7 days after first primary threading. So first threading is called primary threading, and the second one is called rethreading. So second or third or some it may go for a 3 months and all till if it is a big track and all. Okay. So according to the Shara Balam, you have to see whether it is strength is in there, because it will be used up. Okay. So it will be like a plain thread. All the Shara or whatever we have pasted on this Shara Sutra will be absorbed. So that is about how the Shara Sutra is applied. This is a reference from Sushra Chikitsa, 17th chapter, that is Nadi Vrana Chikitsa. Then post-operatively, we will be giving all the medicines, Gandhaka Rasayana, Triphala Guglu, and sometimes Matra Vasti also, so that motion is clear. Okay. Then rethreading and in between, Avagaha should be given. So mode of action. So already no Pajano, Vilena, Shodhana, Ropana, Shoshana, Lekana. All these properties will help in the like a chemical fistulectomy. That track is getting excised. Okay. Then a dissolution. There will be unhealthy fibrous tissue will be formed in the track. So that will be dissolved because of the powerful potency of the Shara. Then drains out the pus and all will be controlled or reduced, drains out the and fibrous tissue also, and creates a base for. So all the dead cells will be eaten up, and the healing will be. So one side it will be cutting, and the other side it will be healing. Okay, and removes the debris, and healthy granulation tissue formation will be there. So that is the mode of action. Next, coming to Shara Sutra in Arshas, actually in fourth degree Arshas or in external hemorrhoids, we'll be using Shara Sutra also. So in that also, the mainly because of a tying, the tight tying, there will be mechanical strangulation, chemical cauterization action, and necrosis. Because of the tightness and the burning action, there will be a necrosis and the debridement of unhealthy tissues. Within 5 to 7 days, the arches will be fallen off. Okay. Then in case of arches, also Anloma drugs will be given. Then Avagaha Sweda, mostly the ligated mass will be sloughing off by 5 to 7 days. Matravasti with a Yeshti Madhutaila is given. But in case of arches, most of the complications like a pain, burning sensation, that is severe burning sensation, and sometimes the dermatitis, like because of the any they don't have the like sensitive skin and all, anal region may develop a dermatitis, skin lesions may develop. Then bleeding also sometimes seen as complication. In case of management, reassurance, and the patient's motivation, educating them to do the proper methods like avagaha. And instead of shara thread, we can convert it to a plain thread. Okay. In modern, actually, they are using seton thread. Like when our Shara Sutra, after seeing our Shara Sutra only, they have started this seton thread. Okay, CTON, seton thread or plain thread we can use. Then, but in some cases only the patients will be having some sensitivity towards the Shara only. This condition is complication is seen, and we can give Matravasti, Yashti Madhudaila, then Anlomana drugs we can use. Then coming to Patya. So Sarveshu cha Shali, already you know Shali Shashtiga Yava Godumannam. So all these are the Shali Shashtigam Yava Godumam. Then Sarpi, so that the body snigdada is increasing. Sarpi, snigdam upa vaseda payasa, nimbu yushena, nimpa yushena, padola yushenava. So all these drugs are also helping for the healing or preventing harshness also. Okay, then shagam, all these leafy vegetables which will be having vegetable fiber contents. All these will be patya for the any arsha patients or any in case of these conditions. Then apatya. So in arshas and all. So only I have just added so that this and all should be used along with the shara also. Shara while we are doing the shara karma or in these conditions we should be doing all the following all the patyavatyas also. Like traveling also we have to reduce or because otherwise it will go means any friction it will be causing and it will increase the symptoms. So only this Patya Patya session I have given. So these all are in the arshas and all what all things are Patya. You just go through that. And coming to the advantages, already I have told in the starting not what Shastranu Shastre because of the simplicity in the procedure and safe and OPD like procedure, OPD based procedure. It is very useful and the minimal hospital stay, minimal bleeding, minimal trauma and the scar formation also because the already the unhealthy granulation tissues will be withdrawn or destroyed, so it will be scar formation also, it will be very less and cost effective and compared to the surgical removal. Okay, and recurrence rate is also very less. These are the some of the research works like Snuhik Shara Sutra, Deshpande ji has done. Then Udumbarak Shira Sutra, then Papaya Sutra, then using the papaya's milk only. So some examples are given: Yavakshara Sutra, then Gridha Kumari Shara Sutra, then Aragudadi. So these are the drugs explained in the 23 drugs explained by Sushrutacharya, Palasha. So these are even some studies based on CCRAs, ICMR, and all have proved Shara Sutra as best in this anorectal diseases and some of the sinus also. So even allopathic doctors have to adapt so that or they have to refer to us regarding this because we are having more benefit in the than the surgical removal. Then Shara Sutra like we have to establish different sessions like centers like we are having Shara Sutra separate clinic or centers in district hospitals so that the patients can use it. So we have to encourage the procedures and mainly in Shalya people are practicing that. So coming to the importance questions, Shara Karma. Already I told the Pradisarnik Shara or application of Arshas in Shara Karma in Arshas. All are important questions. Like Shara Karma, Chigilsite is asked. Otherwise, application of Shara Karma in Arshas, like that questions will be coming. Then about Shara Sutra, the preparation. So you have to by heart that to Hikshere, Rajni Chuna that sloga you have to by heart, and that is the preparation sloga. Then indication and contraindications and the methods of application, complication, and the management should be used, should be written. That complications I have told in Shara Sutra. what are the complication, how they are to be managed and all. Then steps of Shara Sutra application in fistula in ano. So once you will be coming across with the fistula and mainly fistula and pylorus sinus. So I will explain what during the class of anorectal. I will explain what is the difference between a sinus. I think you would have understood. Sinus means it is a one opening is there. It is into the tissue. Okay. Externally, we are seeing a one opening. There is no connection to any other organ. So in that that is called sinus. So in case of uh, there is pylonidal sinus. Pylonidal sinus is there is hair, tuft of hairs are there inside one cavity. So superficially we can just see an opening. In that opening, there would be a track. When we are probing, we can see that it is going to a deeper area, but not going opening in any other region. So that is called sinus. So in pylonidal sinus, inside that pile hair or inside that sinus there will be hair. So only it is called pylo means hair, nidus means nest. Okay, so there is a tuft of hairs inside a sinus. So in that condition there is no external opening, so we have to take it out, take the probe which is having a tip as a sharp end or like a needle. We have to make an extra opening. Okay, so that how the that steps you have to write in notes. I will be giving that the steps of Shara Sutra application in both hemorrhoids, fistula, and in pylorus sinus. Three headings should be there. Then Shara Nirukti already told. Then Pradhan, the importance of Shara Shastra and Shastrebhya, that's sloka. Then Shara Guna Dosha. Then types. Then Yogya Ayogya. Then importance of Shara and Shara Nirmana Vidhi also asked. Then all the Dagda Lakshanas, then standardization of Shara Sutra. Mainly, I told the coatings, how the coatings should be. Like 21 coating, that's 1173, that we have to explain. And the standardization, then pharmacological action. I have told the mode of action, how it will be. Okay. Then coming to the 5 mark question, this itself like Pradisarnik Shara, simply they can ask Panik Shara, Pradisarnik Shara, then Shara Sutra application, then Shara Dagda Lakshana, then 3 marks like simply guna and dosha, then pradhanyata, then panya indications or contraindications like that. Sharavarti actually it is comes in a gulma. Okay. So it is told in the end of this chapter like a Visha Agni Shastra Ashani Mrityu Kalpah Sharo Bhavandi Alpamadi Prayuktaha Sadimada Samyak Anuprayukto Rogan Nihanyat Achirena Thoran. So what it is told when applied by an who is not having much knowledge about Shara or having less intelligence. Okay, that will act. Shara can even I told it can the Lakshana it even result in death. So it is just like a sharp weapon or any poison. Poison Visha Agni Shastra Ashini. So either a poison, fire, or a sharp weapon, or a thunderstorm. All these, how will it will result in death. So like that, potentially is there for Shara if it is used by an not poor intelligence or who is not having a proper knowledge of Shara is using that Shara. It will result like this. And same Shara used by a properly by an intelligent person cures even the dreadful disease quickly. So that is the uh, importance of the Shara. So we have to use it as carefully. Most of the uh, sorry, recurrence of many diseases can be done or used using Shara. Then preserve the in case of anorectal diseases, it will preserve the anal continence and the sphincter integrity. So because of that only, otherwise in surgical removal means it will cause like anal incontinence. They won't be having any the involuntary, that voluntary control of passing motion will be lost. We can see most of the case of carcinoma and all. We have seen that if they are doing the anorectal surgeries, after that they are going for 20 times and all per day motion they are passing because of the incontinence. Whatever they are eating, they can't control the what they have digested, it is going. Okay. So like that complications is not there in case of Shara Sutra application or a Shara Karma application. Then if we are using like excision and then Shara Sutra also giving best result, then Shara Sutra therapy is an Indian contribution to the world. So that is all about the any questions you can ask. Before that, I will just show the how we have prepared a Shara last year. Actually, we have prepared nicely in 2019. And okay, and, so how, this was the collected. We have collected from the surrounding of our college itself, like heaps of apamarga we got, and we have burned it and taken the ashes. So the internees and the finalist students have done a very good job in that. It is from Ayurveda College, Coimbatore. So after that, we have kept in the first figure. You can see that it is the ashes mixed in water, and it is drained, okay, or filtered 21 times, 21 times in a thick gada cloth. And then lastly the clear water is got, which is not having any dust particle in that, or ash particle is not there. Then it is the first figure is the boiling, boiling, and it is reducing to that thick like paste like a consistency. Then adding the shuddha sarkara and all, red hot, making an iron vessel red hot, made into red hot. You can see the white color. Then that paste like formation how it is there. Then lastly we will be adding chitragam moola, we will be making into kalka. Okay, kalka, the first figure is the kalka. Then we'll be adding that so that it is the potency is increased. It is made into Tikshna Shara. It is mixed well and taken out and weighed. Then this is the application how the Shara Sutra cabinet is. Okay, in the first that 21 coatings and all we should be doing. That is the tube light, actually ultraviolet radiation that the tubes are, so that it will prevent even the fungus or anything, because we are daily we are wetting it with a substance. So it is like a moisture control should be there, and it should be like a sterile atmosphere it will be created by this. And this is the last, actually it is very enlarged photo, so only like this. So this is how it will be, the thick coating of the all the shira, apamarga shara, and this one turmeric will be there. Okay. So uh, shall I do once more, just a revision I will do, or any doubt is there? Annapurna and Niharika, if any doubt is there you can ask. Or shall I just remind once more? Any portion you need further classification means I can tell. Yes. So shall I just go once more? Okay. So I told Shara, how the preparation of the Shara is done. Then procedure of Shara Karma and Shara Sutra will be explained. So it comes under Anushastra and Upayandra. Then coming to the Nirukti, Tatra Sharanat, Shananad Vaksharaha. Then coming to the Shara Mahatva, Shastra Anushastrebhya, Sharaha Pradhanatama. Okay, because what is the importance because of that? Shedya Bedya Lekya Karanat, Tridoshiknatva, Vishesha Kriyavacharanat. These are the 3 points you have to remember. Chedya Bedya Lekya Karanat, Tridoshiknatva, Vishesha Kriyavacharana. So Chedanam means excision, then Vedanam cutting or dividing, then scraping, Lekhanam. And then because of the importance of the drug, we are using Tridoshagnam. Vishesha Kriyavacharanam. In that Alhana commended like a Pittarsha, even in Pittarshas, we can use a Shara. Okay. That is the importance. Then Shara Guna, then classification mainly Pradisarnikshara and Panikshara, then Mridu Madhyama, Tikshna. So this is the indications. Kushta Kidiba, I have told. No, you can learn like a KZ diseases like Kushta Kidiba. That I'm audible.
Yes, ma'am.
So Pradisarnikshara, these are the indications. Then Panikshara, according mainly internally what all diseases comes like GIT diseases, Garagulma, Udara, Agnisanga, Ajirna, Arojaga, Anaha. All these we can consider as a uh, indications for Paniyakshara. Then Sharkara Ashmari and all the other common diseases like Vidradi, Krimi, Visha and Arshas. Then coming to the contraindications, Rekta Pitta, Jwara, Pitta Prakriti. So mostly the Pitta important diseases or in case of Bala, Vritta, Durbala and all. And in case Mada, Murcha, Timira and all, there will be contraindication. This also like in marma or a sarvanga shuna. All these condition, it won't. If you use also, it won't succeed. So these are the contraindication. Just you can contraindication. Just learn one sloga. Then other you can learn as add as the points only. Then nirmana like pradisarnya kshara nirmana. How it is done or all the types for pani and mridu. Mridu is the use for pani kshara. So how it is done? We have to just this is told in a chart, so you can just easily you can remember that one. See this one. That is we have to dry that plant, then burnt, then that 500 grams of ash is taken and 6 times of water is added, filtered 21 times through cloth. Then we will be getting a clear solution and that will be boiled and evaporated and getting up to heating so that and it is that we will be adding red hot limestone and we'll be evaporating again. Then lastly we will be adding the tikshna dravya or the chitradga. In that case we will be getting tikshna dravya or trishna shara. So mridukshara is a one of one other name is samyuhimakshara and Tikshna Shara, Pakyakshara. Okay, Pakyakshara or Tikshna Shara. That term it should be sometimes it will be asked if, as explain Pakyakshara Nirmana. So in that case we have to explain the Tikshna Kshara. Okay. So that is about that. Then Shara Guna Dosha, you have to by heart that sloga. Then coming to the Shara Karma, that mainly explained based on Ashes. So Purva Karma, we have to make the patient comfortable position. Mainly in our Ashes means we'll be making him in a lithotomic position with all the instruments ready. And we have to inspect that region and use a lekana or pradisarna should be done. And using a shalaga, we should smear the shara on the site of the disease. Then a period of after Vakshada Matra, we have to wait. And then after that, we have to apply the Amla Dravya. Okay. So that is the procedure we will be doing. Then if it is not getting fallen off, then at that time, alepana of the paste of Amla Kanjika Bija, Tila and Madhuka is used. Then these are the Lakshanas. Tatra Samyak Dagde. This you have to by heart. Tatra Samyak Dagde Vikarobashamo Lagavam Anastravasya. Hina Dagde Toda Kandu Jatyani Vyadi Vriddisha. Adi Dagde Daha Paga Raga Angamarda, sorry, Strava Angamarda, Klama Pipasa Murcha Sur Maranamva. So I have told it is one of the most complicated thing also. If it is not an ignorant person or unable to control the complication, it can result in the complication as death even. So that is Lakshanas compiled. Then Amla Rasa, importance of Amla Rasa. That is a Amla Varja Sarva Rasa is a Shara. So along with the Amla rasa we are adding means it will be converted to Madhura Pradhana, and that Madhura rasa is causing Shamana action. So only in Paschat Karma we are adding Amla rasa. Then Panyakshara, it is explained mainly in each diseases which are indicated in Panyakshara. Example, Gulma and all. We'll be teaching it later. Then in Arshas, application of Arshas, as I already told, lithotomy position. In that local anesthesia and or spinal anesthesia we can give according to the condition. Then we'll be using a proctoscope to view that mass, and in that we'll be rubbing that on that pile mass, and Shara is applied on the internal pile and wait for Vakshada Matra. And when it is changing to a Pakwa Jambu Phala Sadrisham, then we will be washing with a lemon juice, and then Yashti Madhugrita and is applied, and Asho Yendra is removed, and packing should be done. So these are the post operative, and you can see that this color difference has come. So these are the advantages, like pain reduction. Pain is very less, no bleeding, minimal hospitalization, total treatment duration also is very less, and complications are like bleeding, pain, discharge, structure formation, recurrence, but very less only it will be happening. Then the mode of action, mainly in case of there is a bleeding condition and all. In case in that condition there will be coagulation, so that is a main thing. Then in case of pile mass, mainly the mass, it will be getting necrosed, so it will be happening in 3 to 7 days, and there will be minimal like scar formation and obliteration of the vein and complete wound healing mostly by 21 days. Then coming to Shara Sutra, as I have told, these are the people who have done the wonderful job of standardization of the Shara Sutra, where which is not having proper like a reference in Brihadrayis. Only in Chakradatta we get the exact reference. Bhavitam Rajani Chune Snuhi Kshiri Punaha Punaha Bandhanat Sudridam Sutram Chinati Arsho Bagandaram. So in Arsho Adigaram only it is explained. So Arshas in Arshas and Bagandaram we can use a Shara Sutra, like that it is given. Chikilsa Danam, it is explained how we can do the Shara Sutra procedure, that is explained in case of Nadi Vrana Chikilsa under the Nadi Vrana Chikilsa Adhyaya, that is 17th chapter Chikilsa Dana. It is explained then how we are preparing Apamarga Shara Sutra. These all are the things we need. Apamarga, Snuhikshira, then turmeric and the cabinet. Okay. Then collection of Snuhi should be done. Then actually it should be collected early morning. Okay. Early morning mainly during the summer season. So it should be collected and transferred to a glass bottle, and without becoming it clothes, we have to apply daily. First I told 11 days, first we have to coat with the Snuhi Kshira, then next 7 days with the Snuhi and Apamarga Shara mixed with, then after that Snuhi and Haridra for 3 days. These are the indication. Krisha Durbala Birunam Nadi Marma Sridachaya Sharasutrena tam chindyat natru natu shastrena puttiman. Then these are the contraindication. Actually, as such, contraindication is not explained as textual, but only in case of practically where we are failing in case of Shara Sutra. We are getting some conditions like osteomyelitis, tubercular fistula in fistula in ano, then fistula from ulcerative colitis and Crohn's disease, which are like in some uh, diseases we'll be learning later in the diseases of small intestine and large intestine. Then hydroadenitis suppurativa. I think maybe you have heard in gynecological practice also, because it is related to some hormonal also in case of female. So in that case also multiple sinuses or tracts will be formed mainly in axilla or in pubic region where there is hairy growth is there. In that cases, hydradenitis suppurativa will be there. Then in case of fistula of a urethral and urinary fistula, we are not using Shara Sutra. Then preparation of the patient, mostly we have to do IM in, because we are exposing the region. So we have to get a TT injection, then a test dose, and we are giving local anesthesia. So test dose should be given early. Then all the investigations, like whichever helping the patient, like we have to avoid the complications of any bleeding diseases or low HB and all, we have to rule out. Then for our safety and for the safety of the instruments, contamination all, we have to do HIV, HBsAg, then rule out tuberculosis, ECG, and all. We need to do X-ray and ECG, then fistulogram to see the track that we'll be explaining during the fistula explanation. Then application, told using a probe, we will be finding the track, finding that sinus or the track, and using the Shara Sutra is applied behind the probe and inserted. Then made tied using both the sides will, the ends will be tied. So that is about Shara Sutra application. Then rethreading will be done after 7 days. Mode of action and all explained. Then in arches, 4-degree arches we'll be doing. So that also result in necrosis of that part. Post-operative management using anloma drugs, and avagaha is a must. Matravasi also should be given. And complications, pain because of the tikshnada, there may be pain, severe burning sensation, but dermatitis, but rare only. Some sensitive skin people only will get all these complications. Otherwise, it will be uh, simple procedure only. Then complications, we have to do avagaha sweta, then matravasti, and whatever things for getting constipation cure. Then patya should also be followed along with the Sharasutra application, mainly in arches and anorbital. These all are the example of Sharasutra, different Sharasutra they have tried with advantages and disadvantages. Like and some so many studies are going on. These are the important questions. If anything is there, you can just ask. Yes.
Uh, ma'am,
Yeah, tell me, Niharika.
ma'am, Samyuhima meaning ಏನು ma'am word?
No, actually, that is the extra name only. Meaning, if you need means, I will ask and tell. Just leave me a message. I will ask Sanskrit scholars and just tell. Because that term itself is like mridu. Maybe that term itself may be like mridu, mild in potency, like that. Some term will be. Because if you are
Okay.
adding not that Tishna Dravyas or like Kada Sharkara, Baspa Sharkara or Shankanabi, all these we are not adding means it is Mridu only. Okay. So that is another
Okay.
name given for Mridu. And Tikshna Kshara, it is called Pakya.
Okay, ma'am. Thank.
Okay.
Okay, ma'am. Thank you, ma'am.
Yeah. Anything else? One more student have joined first time or already was a member. Subra Jyoti.
Yes, ma'am.
Yeah, yeah. You were there already? Because first time I'm seeing, so only I knew.
No, first time I joined, ma'am.
Okay, okay, okay.